Welcome to Ithaca DSA Presents. I'm Wayles Browne. Today we're talking to René Rojas, who's a sociologist from human development at Binghamton University. And our topic is the virus epidemic that everyone is conscious of, COVID-19, but what would be a socialist response to a crisis like this?
Hello?
Okay, what could socialists do about a crisis that other people couldn't do?
Well, it's a big question, and at the moment it is a hugely important question which we should all be grappling with. And I think any response from the left, from labor, from organized working people, from socialists, has to start with an understanding of what's gone wrong up to this point. And what's gone wrong up to this point is not just the biological dynamics of the contagion and the spread, right? That's happening in a certain context, in an institutional and a political context, which has exposed, right, many weaknesses, many flaws, many shortcomings in how we deal with these types of matters, and is actually fueling the pandemic itself. And I think, in a word, what's gone wrong up to this point are markets, are freely functioning markets, and we live in a society in which elites and politicians and the political class, right, have assigned to markets and to businesses, right, the role of responding to these crises, and markets simply can't. They have failed, as they do quite often, but in this case, they have failed on a massive scale and with tragic consequences. So we can go into what those failures are exactly.
Yeah, how do markets, well, is it true that markets function well in normal times and then they only fail when there's a crisis? Or do they fail other times as well?
No, markets are continually failing, in fact. It's a feature of market societies and freely functioning markets. The promise of free markets, right, is that through the price mechanism, right, balancing supply and demand, right, they send signals to producers and buyers, right, in terms of what to make, what to produce, what to put out on the market, and how to distribute these goods, right? And that price signal is supposed to tell producers what to make, right, and where to put them for sale, right? But the fact is that that type of information mechanism, right, that signal to producers, right, the signal itself fails often, but then on top of that, the ability to respond to these signals often is not existent. And that's what we're seeing today. But to answer your question, it's not something that only reveals itself in times of crisis. Markets perennially, right, are making these mistakes. Now, the problem is that in making these mistakes, right, there's social challenges that we're always facing, right? There are responses that as a society we need to be making, both in times of crisis and in quote-unquote normal times, right? And when markets fail to produce these outcomes, it leaves many people vulnerable to the consequences, and that's what we're seeing right now.
Is it true to say that the United States is a society that's more based on the market mechanism than others around the world?
Yeah, I think globally, of course, since the 70s and really since the 80s, there has been a push on a global scale to ramp up markets, to scale back social provision, right, and public provision and production, right, not just provision and distribution, but production of goods. In certain countries, that drive to ramp up markets has been far more aggressive than in others, and the U.S. is one of those cases. And it's been more pronounced in the U.S. not only because the drive to promote markets has been more intense, but because even prior to the 70s and 80s, right, we already had one of the weakest forms of social production and social provision of goods. But the U.S. is definitely at the forefront in terms of the type of society that privileges markets, that promotes markets, and leaves, right, all kinds of social outcomes to the mercy of the functioning of markets. And you see this across the board, and you see it in ways that have become really relevant and pronounced in this electoral season, right, in terms of healthcare. The U.S. stands alone, for instance, among advanced capitalist democracies as a country that allows markets to really do a lot of the work, or lack thereof, right, in terms of healthcare coverage and healthcare provision. We can talk about what the healthcare system looks like and how the role that markets play in it, and how that's in turn helping to shape the coronavirus situation. We see it in other areas as well. We see it in terms of, for instance, education, right? Where, in particular, higher education, college, post-secondary education, is largely market-driven in this country, meaning that you have to buy a college education for your kids if you want them to be college educated. And of course, you see it in other realms, such as housing, where public provision of housing in this country is just almost non-existent. It's paltry. And then protections that both homeowners and tenants, renters, might receive from the state, right, from the public domain in terms of their rights vis-a-vis owners, right, in the real estate industry, almost non-existent as well. We let markets do their thing even after the massive housing crash of over 10 years ago.
You're thinking of 2008, where it came out that the financial markets had been buying and selling securities that were based on people's mortgages.
Yeah.
And somehow they didn't get the information that not all of those people were going to pay off their mortgages.
Yeah, it's a perfect example. Perfect, not in a sense of good.
Yeah.
It's a very revealing
yeah.
example of just a massive market failure on the one hand, and on the other hand, the social consequences, right? The fact that it left tens of millions of American families, right, without a home and without basic protections in terms of shelter and having a roof over their head. And it was precisely because of what you mentioned, right? Mortgages were commodified, were marketized, they were turned into goods to be speculated with on the market. The finance industry got hold of these, invested in them and reinvested them, and spread out these risky mortgages throughout the system, right?
Uh-huh.
So it brought down not only the housing market, but the financial market as well.
So maybe it was just poetic justice to see some of the finance firms on Wall Street fail at that time, although far from all of them.
That's right. But in here, I'm glad you raised this because it gets us back to the current situation. Because while some of them failed, right, most of them got bailed out, right? And what these bailouts were, on the one hand, in a very direct sense, were an immediate infusion, right, of hundreds of billions of dollars, right, of public money, of the state's revenue into these private corporations to keep them from going under, right? So
you've been saying this like with a passive verb, were bailed out, but in fact this was money that the federal government put up to.
That's right. It was our money, right?
Yes.
It was public revenue, right? So that's what it was in the immediate sense. That's what the bailout actually looked like, right? This massive infusion of public money into these too big to fail banks and financial entities, right, to keep them afloat. But on another level, and again, this gets us back to the current situation.
Yeah.
What were these bailouts? Well, it's a massive admission that markets don't work and that markets need to be corrected when they fail. So the problem then becomes, what will the correction look like when another massive market failure, like the type we're seeing now, right, rears its head? What will the response be, right? Will the response be one that simply infuses mass capital into the private sector and not only keeps corporations afloat, but guarantees massive profits, right? And keeps everything going as usual? Or, right, do we take this opportunity to not only recognize the market failure, but intervene in ways that prop up not profits and not corporations and the profits they're after, but props up public provision of social goods, goods that we all need, that we all deserve. And that's the situation we're currently facing with the coronavirus spread, the contagion, the pandemic itself, but also, of course, the meltdown, the economic meltdown that it's dragging in its train.
Okay, you say we must intervene, but that we means the federal government once again. And they did pass a bill through Congress a few days ago. We're recording this on what's today, the 21st of March. That is supposed to provide bailouts for somebody. Do you know who's going to get them? Who is the somebody?
Well, so far it looks like they just want to repeat, right, the playbook from last time. The bailout once again is a massive. It looks like it's going to be a massive giveaway, right, to for-profit corporations, to these too big to fail corporations. For instance, in the airline industry, right, that have been naturally, right, with the restrictions to travel, with the fears around spreading the contagion, they have been hit very, very hard. But what it looks like is that once again, public revenues, right, will be delivered basically for free, almost with no strings attached to these corporations. What did they do last time? Last time when they got this bailout, this infusion of our public revenues,
Yes.
A big chunk of that money went into what's called buybacks, stock buybacks.
Yeah.
And and I'll spend a little bit of time. I won't go into the details. I don't fully understand the details, but what happens at these times of meltdown, right, is that the stock market is crashing, right?
Yes.
In other words, the value of the corporations, right, and the shares in the corporations start to plummet.
Yeah.
Right. So the bailout is intended, at least in theory, right, to get the industries functioning again, to get the industries to invest in more productive capacity. One of the big reasons for that is to get people working, or to make sure that people aren't laid off. Right?
Yeah.
Instead, what did these corporations do? They took these, hundreds or dozens of billions of dollars that they each got individually, and they started buying their own stock, which was plummeting, with one aim in mind, which was to once again reinflate the value of the stock. Because if you start purchasing a lot of it, the demand for that stock goes up and the value of it goes up. But none of it led to what regular working people, the majority of people, would have wanted, which was, again, to ramp up the types of sustainable production which we all need to keep the economy afloat, to keep people's jobs and their incomes flowing, right? And of course, to do so in a way that's more ecologically responsible. None of that happened. It looks like, once again, that's what the Trump administration wants to do. The bailouts in their current form, right, just again look like this no strings attached infusion of capital for these corporations, so they can restore their profits, restore the massive salaries of their CEOs, right, without it having the theoretical trickle down impact it's supposed to have, right, throughout society and for the workforce.
Okay, so this is another way in which markets can fail. The individuals or corporations can manipulate the prices of securities on the financial market. It's been true for a long time that they could manipulate the prices of goods on goods markets.
Mm-hmm.
So the markets have not been functioning as a conveyor of information.
That's right. And if they do convey information, they convey the information for certain purposes, but not necessarily for purposes that improve the overall public good, which in theory it's supposed to do, right? So let's take that portion of the current bailout, which is the bulk of it, and compare it to the measures that are being discussed to help working people, right? The big plank in this package with respect to protecting working people has been the initiatives around paid sick leave and paid family leave, right? And of course, the Democrats, when they passed the House bill, they made this huge, kind of spectacle of how they were protecting working people, right, by including these provisions for paid sick leave. Well, it turns out that once it got through, it only covered 20% of working people. Firms with over 500 employees were exempt, and then smaller and medium-sized firms were exempt as well. So again, what does the bailout do? Massive profit guarantees for these corporations through the option of buying back their stock, and leaving most American workers out to dry. What we should be doing, of course, is taking this opportunity to intervene in markets. I mean, after all, there's a tacit admission right now across the board, even though they're not saying it, that markets have failed, as we've discussed. So we should take this opportunity to intervene and not just correct markets, but take markets out of the provision in certain areas, right, by advancing much bolder and aggressive policies. For instance, Medicare for All. Medicare for All is one of these policies that right now would have a huge impact on the way that the virus and its attendant economic crisis is affecting working people. And if we can get into how that might work as well.
There have been some promises that the government would take over medical bills that are connected with the coronavirus epidemic. Apparently not other medical bills, but those medical bills. And I just read a campaign announcement from the Bernie Sanders campaign where he said something like this: well, maybe we cannot now get a Medicare for all, but at least we can try and pay medical bills for victims of the pandemic. No, actually, one might say, well, why couldn't we have Medicare for all? But this brings up a bit of a more general problem. There's a history of exploiting a crisis when it comes around to make pro-capitalist, pro-neoliberal changes, but perhaps also there's an opportunity to exploit a crisis to make pro-progressive changes. What do you see now going on? Can we have positive changes, or are we stuck with negative changes?
Well, we open by saying we're going to explore the possible socialist response to the crisis, and I think that's exactly what the socialist response should be. It should be to turn this into a political battleground right now. Right? It's not a technical issue. It's not just a medical issue. This is a political fight we're having right now, right? And we have to make sure, as you suggest, that the response is not one that's just extends markets and extends profit opportunities for corporations. That this is what Naomi Klein in her famous book from over 10 years ago called the shock doctrine, right? Where political elites take advantage of these shocks, these crises, the uncertainty, right, and the fear that they produce in people to push through these reforms or counter reforms, right, that just advantage corporations. Well, we need to do the opposite. we need to take advantage of the uncertainty right now, of the fears, right, of this, the shock of the moment to push through socialist alternatives. And one of those, for instance, would be to take this opportunity, right, to push for Medicare for all. And the Sanders campaign, I think, has it right. If I understand correctly, Sanders' proposal is saying, look, right now, in the immediate sense, we can't pass Medicare for all. But let's actually take measures, right, that get these types of policies operating right away. So we know, for instance, that there are tens of millions of people uninsured, and another massive, dozens of millions that are underinsured, that right now, these are people who don't have the ability to pay for any healthcare related cost coming from the virus. Or they might stay at home, for instance, even people who are insured, but they're underinsured because, they're still expected to pay some of their medical bills. They might not go out and get the test, right, and get the treatment they need because they're fearful of the bill that they'll receive. So the Sanders campaign, and this we should all get behind it right now, right, is saying, for the moment, let's make sure everyone has their health care needs met, and any costs that are attached to the virus, for instance, testing, for instance, if think people get sick enough they have to be placed in intensive care, right? And maybe they get pneumonia, they need a ventilator, right? Any of those costs will be billed not to the person, right, but to the National Health Insurance Program, Medicare, right? That's what we need right now, right?
I would certainly like to see that, and not sure what we can get on the federal level, but for quite a few years we've been discussing a New York statewide health program called the New York Health Act, and we can say that's also something socialists should get behind. It's a question where the priority is right now, working on New York State or working on the federal level.
It's interesting. I was involved in national Medicare for all organizing. I have not really been involved in the state version too much, but I think we should hit on both sides, if you will. We should be demanding both, because what there is now, again, there's this tacit admission on the part of political elites, politicians in Washington and in Albany, right, that our healthcare system, as it is designed now, is not working, right? That's one. So that admission is coming from above. Two, in the general public, there is now a very, a crystallization of this fact that, hey, our healthcare system just doesn't work for people, right? It leaves a lot of people exposed and has them fend for themselves, right, with these exorbitant costs. So this is the moment to push on both the federal level and at the state level for these types of reforms. I think that there's an opening right now. Of course, the organizing around it will be very difficult because of the conditions imposed by the pandemic itself. But throughout history, right, these crises have been opportunities. They have been these moments, right, where there is this tugging, this fight, this back and forth between elites, corporate elites, and working people, right, to try to shape reforms that come out of it in the interest of one set of people versus other people, in the interest of employers or in the interest of working people. There are very good examples of this. In the U.S. alone, the reforms that came out in the 30s and the New Deal era, right, were responding to a national crisis, right, an economic meltdown, and the progressive reforms we got, like Social Security, like the Wagner Act, right, the National Labor Relations Act, which gave, for the first time in this country, workers the right to organize, to unionize, and to bargain collectively, right? These were all outcomes of that political fight of the moment.
Of the Great Depression.
The crisis of the Depression.
1929.
And the working class and popular sectors were able to get organized and muster enough pressure, right, given this opening, to force the federal government in that direction. Another great example related to healthcare, as we've been speaking, since we've been speaking about healthcare in the U.S., is the health system in the UK.
Yeah.
Right, it came out of the crisis and the ruins of World War II, right, where you had the working class that had given its children up, right, its lives and sacrificed, right, coming back to a country in ruins, right, and this issue came up. How do we respond to the healthcare needs? And it was a moment that the Labour Party in particular, but with support, ironically, from conservative sectors, were able to say, look, when it comes to healthcare, let's push in this direction. Let's not open up this up as an opportunity for private healthcare provision and the profits of healthcare corporations. Let's make it a public good.
Okay,
and they were able to push in that direction. And that's what we need to be doing right now in this context.
So you can say the Depression of 1929 and the destruction of World War II both created teachable moments. There is a history of capitalists using disasters as a tool to push capitalism, and Naomi Klein brought in the term disaster capitalism. But we might wrap up by saying socialists have to respond with crisis socialism, explaining to the public the need for help from the government and the lack of response that they might expect from the market mechanisms. Okay, wrapping up, although there is much more we could say about this. This has been Ithaca DSA Presents. Your host, Wayles Browne. I've been talking to René Rojas, sociologist from SUNY Binghamton, or Binghamton University, from human development there, and talking about, as I say, crisis socialism as a response to the COVID-19 pandemic and what we can do in teachable moments like these.
1, 2, 1, 2, 3.